We age with time. This was once considered an unavoidable fate of living beings. However, modern medicine is trying to overturn that common sense. The most talked about cutting-edge medical technology in the world today is reprogramming, or cell reprogramming. In short, this is a technology that rewinds the hands of the cell clock and returns it to a younger state. What if we could restore the nerves in our eyes that have deteriorated with age, damaged hearts, and even brain cells to a healthy, like-new state? This is not just a science fiction fantasy. Researchers around the world are now taking the first steps in clinical trials to make this a reality. So, what exactly is the mechanism of reprogramming? Its foundation lies in the iPS cell technology, discovered by Professor Shinya Yamanaka of Japan, for which he received the Nobel Prize. Our bodies originally begin as a single fertilized egg, and then specialize into specific cells like skin, heart, and bone. Previously, it was believed that cells, once their role was determined, could never return to their original state. However, Professor Yamanaka and his colleagues succeeded in reversing time to a newborn state by introducing 4 specific genes, commonly known as the Yamanaka factor, into cells. To put this in simple terms, it's like completely resetting a computer that has become slow after years of use, back to its factory settings. While the internal components become sparkling clean, the challenge was that all the accumulated data and even the roles or identities of the cells, such as skin or heart, would be erased in the process. In recent years, a technique called partial reprogramming has been reported as a major breakthrough. It has been highlighted in medical papers and systematic reviews worldwide as a game changer. Instead of completely reprogramming, it activates genes for a limited time. Instead of erasing data, it's like clearing only the accumulated junk and errors in the system, and restarting it to its smooth-running state, maintaining its original identity. Summary studies published in journals such as Nature and Cell are reporting a growing amount of evidence. Evidence shows that this partial reprogramming can restore youthfulness while maintaining function. The key element here is the mechanism known as the epigenome. The DNA itself, the blueprint of our cells, doesn't change with age. However, errors occur in the interpretation of this blueprint as we age, and this causes aging. Reprogramming technology is the most promising approach to correct this interpretation of the blueprint. What specific medical applications can this technology have? 3 major future possibilities are anticipated. The first is treatment of incurable diseases. Research is progressing on treating glaucoma, which restores vision lost due to aging by rejuvenating the nerves in the eyes. We are also seeing potential in rejuvenating brain nerve cells to restore function in Alzheimer's disease. The second is transplant medicine without rejection. This involves treating necrotic tissue from conditions such as myocardial infarction by reprogramming cells on the spot. Because it uses the patient's own cells, it avoids the severe rejection reactions seen with transplants. And the third benefit is extending healthy lifespan. It rejuvenates immune cells that decline with age. This increases resistance to cancer and infectious diseases, maintaining a youthful metabolism. The goal is not simply to look younger, but to maintain a body that stays healthy and active until the very end. While reprogramming is generating great excitement, reviews also point out challenges that must be overcome. The biggest issue is safety. If the initialization process is miscontrolled, there's a risk of cells becoming cancerous. However, as of 2026, medicine is definitely taking the next step towards solving these issues. American biotech companies have started the first clinical trials on actual humans targeting eye diseases. Research into safe gene control using AI is also progressing rapidly, updating technologies daily. Aging is not an unavoidable fate. It may one day become a treatable disease. Reprogramming technology is now opening the door to such a new era of medicine.